Good afternoon, good evening, or good morning, everyone, everywhere, depending on where and when you are watching. It is a beautiful Memorial Day weekend, Sunday afternoon here in America, and outside my door, it's sunny. There are some people who are barbecuing already. There are some block parties. There's lots of noise already going on in my neck of the woods. What's it looking like in your neck of the woods? The prevalence of high blood pressure among Black people in the United States is among the highest in the world. Approximately 40 to 55% of Black adults have high blood pressure, also known as hypertension or HBC. Black people also have a disproportionately amount of high rates of more severe blood pressure, and it also develops much earlier in our life. I am your co-host, Ambassador Lisa Parks, and welcome to Africa Online TV. Now, if you're tuning in on Facebook and you want to join the conversation, join us over here at Zoom. ID number is 514-199-854. Unfortunately, we will not have an editorial at this time, but we're going to jump right on into the conversation with our very special guest, one of our in-house physicians, Dr. B. Tadzong. She is not a stranger to this show. She has been with us on numerous occasions and brought us very important medical information for our African American and diaspora community. Welcome, Dr. B. We're so glad to have you with us today. Our chairperson, Madam Ambassador, Reverend Pam, is not feeling her best, but she is here and hopefully we will get to hear from her later. Welcome, Sister Ruth. I know that you're probably with your family, all 19 of your brothers and sisters for this holiday weekend, and we're glad that you joined us today as well. Again, we are going to be talking about hypertension or high blood pressure in the African American community. The facts concerning Black in high blood pressure was kind of staggering. Again, it says that we develop high blood pressure earlier in life, and usually we have a more severe type of high blood pressure. One of the reasons, I read some statistics that one of the reasons that African Americans have a much higher degree of hypertension is because when studies were done and when studies were created, they did not do them based on African Americans. They were based on Caucasians and other races who have a different set of circumstances. They live in a different type of environment. They eat a different type of food than we as African Americans. Most African Americans here in America, in the diaspora, and even abroad, back on the continent, have a different diet. We live in food deserts here in America. We don't get the best organic foods. We don't get the fruits and vegetables. We send our children to school with potato chips and juices with all kinds of dyes and things in them. Some of these things are contributors to our blood pressure issues. However, if they began to do high blood pressure tests and studies on African Americans, they would see that the number that they consider average is not necessarily average for us. We have a higher degree of numbers in our community. So I'm not the doctor, I'm not the expert, I'm just talking about what I read. So let's get into the conversation with our actual doctor who will bring us some very good information, some more studies, because I'm sure she has studied more than I have, with some clarity in these facts. Welcome, Dr. B. How good to see you.
Thank you, Ambassador Lisa. How are you doing today?
I'm doing good. So how can we, you know what, let's start off with talking about who you are. For some of those people who are tuning in for the first time and don't know anything about Dr. B, you're looking lovely as usual.
Thank you, ma'am. You look wonderful too. Your skin looks great.
Thank you.
Mm-hmm. My name is Dr. B. Tadzong-Fomundam, and I have a very interesting background. I grew up in Cameroon and I came here to the United States about 28 years ago, I think. And I ended up going to medical school here. And I did some research when I graduated from med school. I did research in various areas: kidney disease, HIV transplantation, brain injury, and diabetes. And then I went back and continued my residency. I started off with internal medicine, and then I switched over to preventive medicine. And I've done a lot of other interesting things. I've done, I'm doing lifestyle medicine. That's my passion for life. I have also worked with HIV populations, and right now I'm practicing in dermatology. So it's interesting and it's amazing, and I'm enjoying the journey. But I still have a passion for helping people understand how to better take care of themselves, because nobody can do better by you than you.
Mhm. Thank you so much. So you are going to be, there's a saying that some people are a jack of all trades and a master of none, but you are going to be a master in every area. You're going to be able to, excuse me, you're going to be holistic, because you got your hands in a lot of areas in the health field, and that's excuse me, that's really wonderful. Oh, excuse me, I don't know where that tickle came from in my throat.
That's okay.
So you're studying in dermatology right now, but your passion is lifestyle medicine.
I am actually practicing in dermatology, which I absolutely enjoy. It was a pleasant surprise. But I also feel lifestyle medicine affects everything. It's basically how you live your life, and it affects everything. So for me, it's like it's a foundation in taking care of people, teaching them how to live better. And it doesn't matter what specialty you're practicing in. I think it's still the best way to take care of yourself, in addition to the other things that we can do to help as physicians.
Wonderful. I like that, because for so long, it seems that the medical community has been Caucasian oriented, it has been drug oriented, it has been pharmaceutical oriented, and no one has actually cared about how the person live and how the person should take care of themselves, so that we don't have to use pharmaceuticals keep going up, medication up, and people are finding, especially our older adults, they're finding that they have to choose between their medication and eating, which is not good for anyone. So when we're talking about lifestyle medication, we're talking about how to live, how to eat, how to exercise, so that you can be whole and healthy, as opposed to depending on pharmaceuticals, which all have side effects. And
Thank you.
Bring on other things that we were not counting on. So I'm really happy to hear the term lifestyle medication. I'm not sure if I heard that term before, but I like
lifestyle medicine. Yes.
Lifestyle. I like how that rings in my ear. But our focus today is going to be on hypertension. So let's get into the conversation. How do we curb hypertension? What is hypertension? How does it start? Let's talk about, how does it start? It said, in some of the studies I was looking at, it said that it starts in African Americans very early in life. So what can we do to prevent that, and how does it start?
Okay, so the first thing I always like to do when I start a conversation is just define the problem, and then also explain why we even care. Because if hypertension did not mean anything or do anything, I wouldn't waste my time talking about it. So high blood pressure, the last technical definition I found is a blood pressure greater than 140, which is the systolic blood pressure, over 80, which is 140 over 80, yeah, which is anything greater than those numbers is considered to be high blood pressure, either the greater than 140 or greater than 80. And systolic is basically the blood pressure when your heart is compressing and pumping out blood. And diastolic is the pressure in the blood vessels when your heart is relaxing and receiving blood before it pumps again. So I think that gives a very general parameter. But the other thing is that over time, they've kind of fine-tuned it, because it depends on the age. A fact is that as we get older, and I always think about cars, when you buy a brand new car, everything is still good, everything is still nice, it's still very pliant and so on. But as we get older, just like cars, things become a little bit more stiff, things become less compliant. Your blood vessels are more likely to get a little stiff. And then there's also just wear and tear and other things that we deal with that predispose people to having high blood pressure. And they're also finding, because older people's blood pressures are not as compliant, blood vessels are not as compliant, meaning stretching and allowing for good blood flow. You don't want to over reduce their blood pressures, because if they may end up having blood pressure that cannot sustain them. And then they start having other issues like dizziness. So with blood pressure, even in older people that are hypertensive, the guidelines for controlling their blood pressure are a little bit different. Like with each decade that you're much older, there's a slightly different guideline. And I would let you go online and look for that. I don't want to get too technical about it. There's a slightly different guideline to tell you what is okay for blood pressure for those people. So even if they're hypertensive, there's a level below which you don't want to go when somebody's older. So high blood pressure is usually called the silent killer. And you were asking me about how it starts or when it starts. A lot of people don't even realize it when it happens until they get in trouble. That's why they call it a silent killer. I always think about a stealth bomber, like what we have in the US. You don't see it until it strikes. And so we try to do regular health screenings. We also try to look at risk factors. For example, if you have a strong family history of blood pressure issues, we always kind of consider that you're at high risk. If you are obese, if you smoke, if you drink, if you're always stressed out, if you're not working, if you're not getting enough rest, those are things that give us warning signs. If you love salty foods, those give us kind of warning signs to say this person may need a closer look. And then a lot of times what happens with a lot of our patients, if they're not coming for regular blood pressure screening, they may come in with a complaint of they keep having these headaches, or they have issues with their vision, maybe some blurry vision or something going on with their eyes, or maybe they're having palpitations, things like that. Those are big warning signs for us that, hey, you need to check their blood pressure and see what's going on. So it's not always very easy to tell when it starts, but they're finding more and more, again, like you said, in African-American populations, it starts earlier. And in other races, it starts a little bit later, but that's not the whole story. It's different for different people depending on the cause of the high blood pressure. The other thing that you brought up, which is something that I always find important, I believe in purpose. I I don't waste my time on things that don't have value. So if blood pressure doesn't mean anything, there's no reason why we should be having this conversation. The reason we need to talk about blood pressure is because the price you pay for not taking care of it is very high. If we have a minute, there's somebody said something recently that I would like us to read. So I am a fan of some of Tina Turner's songs. We know her. What's Love Got to Do with It? She just died a few days ago. I think it was Wednesday. Tina Turner was a woman in great physical shape. I mean, the dancing she did, the way she took care of herself, but she said it in March of this year, not too long before she died, that she wished she had known the connection between blood pressure and heart disease and kidney disease. She would have done better taking care of her blood pressure. She was diagnosed with high blood pressure about 40 years ago. It was in the 70s. And it looks like she ignored it a lot. And earlier in the decade, I think about 10 years ago, she started having a whole lot of problems. Apparently, she had a bunch of strokes. And then she ended up with kidney disease, and she even got a kidney transplant, but the damage was extensive damage done to her body already. So it's not something that we should ignore. There's nobody who is safe from the effect of high blood pressure. High blood pressure will kill you regardless of your social status. When the damage is done, it is done. The reason, again, we are concerned about high blood pressure is what we call end organ damage. There are many things that high blood pressure damage in your body. And if you have high blood pressure and you're not taking care of it, I can guarantee you, I'm not suggesting, I'm guaranteeing you that the damage is happening. You're not going to realize it until it's too late. So you have damage to your blood vessels, both big and small blood vessels, because when blood pressure is too high, it's applying too much pressure on the walls of the blood vessels. So it stretches them too much. And so they get weaker. It's almost like something that is elastic. When you pull it too hard, too often, it loses some degree of elasticity. And so that's why when people have high blood pressure, eventually they could have a blood vessel break in their brains and cause a bleed. They could have blood vessels break in their eyes and cause damage to their eyes. They could have large blood vessels, like the one coming out of the heart, we call it the aorta, or the one going down in the stomach, they call it abdominal aorta. Those ones are things that will kill you in a heartbeat if they explode. So if the aorta explodes, you basically bleed out. Same thing with the abdominal aorta, which is what they call an aneurysm. So when the blood vessel stretches too much, it causes what we call an aneurysm on the blood vessel. And once you have that, it's an area of weakness on the blood vessel that could make that blood vessel easily give way And when you have damage to those large blood vessels and they give way, you basically bleed out. And so that's why when people have those kind of things, it's usually a miracle if they survive. So those are some of the things. Now you have damage to your heart because the heart now starts working harder against more pressure. When your the pressure in your blood vessels is high, it means your heart has to pump harder and harder to send blood around your body. And it's like a workout. When you're working out, you build muscle, right? So what we find in patients that have high blood pressure, in the beginning, they have what we call a hypertrophic heart. When you have that blood pressure and you're not controlling it, your heart is just working and working to pump blood. And so it becomes a bigger muscle. But over time, it becomes tired and weak. So you go from a hypertrophic heart to a weak heart. It becomes flabby, weak and flabby, and then you go into heart failure. So these are things that are actively happening. Then we have damage to your kidneys because your kidneys are basically responsible for controlling the blood volume and so many other things. There's damage to the vessels in the kidney. The kidney basically gets beat up. And so when you do not take care of your high blood pressure, you can be sure that you're going to pay for it with damage to one or all or some of these organs. It is really important. I always feel a degree of sadness when I see people walking with end organ damage from uncontrolled blood pressure, because this is a disaster that could easily have been mitigated or stopped. But when they come in at that point, you really cannot stop anything. The damage is done. You just have to help them learn to live life the way it is at this point.
Wow. You know, when you were talking about the aneurysms, I've never heard of a stomach abdominal aneurysm.
Abdominal aortic aneurysm, yeah.
Yeah, I've never heard of that, but I can imagine when you were saying it's like when the blood vessel is expanded and then it starts going back. I begin to think about a balloon that you blow up and it starts to deflate on its own. You've got that certain area that looks like you can tell it's stretched out, and it just begin to put that in the mind that this is what an aneurysm looks like, which is why they can see it on X-rays or MRIs and things like that.
Ultrasounds.
Now we're talking about end-stage organ damage. Let me see my notes. End-stage organ damage from high blood pressure, causing the organs to overwork. And then they get stretched out and damaged. And you say there's nothing you can do about end-stage organ. How do you know that that's the end-stage organ damage is due to blood pressure?
Because usually there's nothing else that does that kind of wreaks that kind of havoc to your body. And usually they come, you would see it across the board. And the patient usually has a history of high and uncontrolled blood pressure. I want to tell you a little story. That's why I said it's always heartbreaking for me. There was a gentleman I worked with a few years ago. He was in his 30s, nice guy, very hardworking. He owned a barber shop. And he came in and his blood pressure was outrageous. He's a young Black guy. And I told him, I said, sir, I am telling you right now, your days looking like these are numbered. And the thing with a stroke or with any kind of end organ damage is that you never know where you will fall on the other side of the curve. You may have a stroke or something and you may have just a few deficiencies, or you may have a stroke and you lose function on one side of your body, or you may have a stroke and you become a complete vegetable, or you may not make it. And we don't know how you end up until you have the stroke. And I told him, I said, sir, you cannot keep ignoring this. He's like, well, I'm trying to hustle. I'm trying to get my job done. I said, sir, I understand the hustle. Okay, I've hustled before. I know what it means to hustle. And I know how important it is to do things that you need to do. But if you don't take care of your body, all of your hustle will come to naught because you're working hard, but when your body crashes, one, you're going to lose all the capital you kept when you're working hard. And number two, you're not going to be able to make any more money because you'll be sick. And I scared that guy. I called the day he came in, his blood pressure was so high. I was really upset and I was really sad because I knew this guy was going to be in trouble soon because I've seen people like that before. But when you're telling people, and especially when they have high blood pressure and they're not feeling a lot of stuff, they feel like you're just being a bother to them. And so it's hard to convince them that you're about to get into trouble. So I convinced him that they took him to the emergency department. They had to basically monitor him because he had a headache and so on. And when you have that and you come into the clinic, we send you in just to make sure that you don't have any active ongoing stroke and that there's no acute organ damage. And then the next goal is to bring that blood pressure down safely, send you back home, and get you to get proper care and maintain your blood pressure at a reasonable level. So I got that for him. And I made him come back in about a week or two. I saw him, I encouraged him. I'm like, sir, you know, it just takes a little bit of commitment to get his blood pressure down. There are things we can do, and we'll talk about those. But I really need for you to accept that this is something you need to fix, because if you don't accept it, you're not going to commit to fixing it. And then I saw him 1 or 2 more times. And then after that, he stopped coming to his appointments because he felt better, right? So he probably figured I've taken care of it. And I told him blood pressure usually doesn't go away unless you do some drastic changes. And even then, you have to keep monitoring to make sure that it's truly gone. If somebody's not showing up, you know they're not getting the care they need. And then that guy didn't show up for a while. And then maybe like a year later, when I went back to that particular clinic to work, one of the ladies there told me, she said, you remember your friend who, I always call them my friends. I'm like, you remember your friend who came here? I said, yeah. They said he had a terrible stroke. He's in rehab right now.
Wow.
Yeah. And I'm like, I'm not surprised, but I'm really sorry that it happened, because I told him and he didn't believe me. And this had to happen for him to agree to it, to believe that this is going to happen. So medicine is an art. It's a practice, because we learn as we go, but also we collect a lot of information. And while our knowledge is limited because we're humans, it's still a pretty good amount of knowledge. We know more than the average person, not because we're better than them, but because we've been taught and we have learned a lot. And so when we see these things and point them out, if you are a patient, please do not ignore it. Even if you don't like your doctor, don't ignore it. Your health and your life is on the line.
Thank you so much, Dr. B. We want to holler at Sister Ruth over here for a minute. Her sign says, why is blood pressure called the silent killer? I believe Dr. B has explained why it's called the silent killer, but let's hear from Sister Ruth. I know Sister Ruth has had some health challenges. I've known her over 30, 40 years, and I've seen her go. We're still very young. We're very.
I'm 27. I don't know
what from where she was diagnosed to the woman that she is now, still dancing, still a worshiper. And it did not happen overnight. And that's what people fail to realize, that the damages and things that happen to us, the diseases that we get, they don't happen to us overnight. So we cannot get an overnight fix. And we're so microwave around here. Mm-hmm. They want to take one pill and want to know, how long is this going to take? It's over in a week. At the end of this bottle, are we done? Welcome, Sister Ruth. How are you today?
I am very well. I know she had said that, but I was looking for a sign, so I just picked that one up. But it is a silent killer, because we really don't know unless we get attuned to God and to our bodies. Because our bodies always let us know what's going on. They don't lie. And we have been trained in a lot of places to keep pushing, and you know, that's okay. You got a headache, take some aspirin, keep going. And, just hustling. And I was reading a book or something that said, hustling can make you the richest person in the graveyard.
Wow. Yep, that is true.
And because I do nutrition, and I talk to people about what they're eating and putting into their bodies, and I tell them, what I love about nutrition is you eat the food, you see how your body responds, and then you either change it or you remain sick. It's not that deep. But I also hear people say all the time, well, it's so hard. Harder than having a stroke? Right. Which is harder? Because life is hard. We must choose our hard. Is it harder to eat healthier or harder to be in the hospital for 3 weeks and on 15 medications? We have to decide and be the boss of our health. And we do need our healthcare professionals, and we need all of that. But if you're not going to listen to them or listen to your body, you're going to end up having that stroke. Or if you believe that the pill is the magic answer and you're not doing anything else but taking your medication, that's not good either.
That's true.
Am I right, Doctor?
Absolutely, ma'am. You're very right. I keep telling people that from a standpoint as a Christian, God is faithful. He didn't send us here to fail.
No.
He has made things workable for us if we cooperate with him. Like what you do to your body, how you eat, your stress levels, your sleep, exercise, even basically healthy relationships. Healthy relationships are good for your heart and for your health.
Yes.
So there's none of those things that you can take for granted. And then, of course, abusing substances. So basically, I went through the 6 pillars of lifestyle medicine. if you do the right things, for the most part, you're going to do well. Every so often, bad things happen. But the truth is that when bad things happen and you are in a good place, you're better able to help yourself.
Yes, you are. Yes, you are. Because bad things happen to good people as well as bad people. It's like a cycle. You have your good periods, you have your bad periods, you're on the mountaintop, then you're in the valley. That's the only way you grow. But we don't have to grow from sickness to sickness in order to get the ideal and get it right. We listen to those, like Ruth said, we listen to our body, who is also the owner of her business, Eat Like a Cow. And we're saying that cows eat, we need that meat for protein. We got to slaughter that cow and eat the meat, but cows are not eating other cows. Cows are eating other meat. They're eating grass. They're eating the greens, which makes them good protein. So why don't we eat like a cow and become healthy, big, strong, like the ox? So talking about hypertension. Now, let me just ask you, Ruth, your heart issue was not based on blood pressure, was it?
My blood pressure was the opposite. My blood pressure was low because my heart was so compromised.
Okay.
And my heart wasn't compromised because of diet. My heart was compromised because I was carrying everybody else's stuff.
Wow.
So
wow.
My heart failed because I cared so much about everybody else and I wasn't taking care of me.
Mm-hmm.
And I tell people, you can have a really good diet, but if you're not sleeping, if you're under a lot of pressure, if you have a lot of anxiety and all the other stuff, and saying you're trusting God, but you're really not because you're sick, trusting God and being sick sometimes just doesn't work.
It doesn't gel together.
It doesn't gel together when you think that you are God or you're Holy Ghost Junior and you're trying to fix everybody in their bad relationships. And it is true. When I got the diagnosis of congestive heart failure and my heart was functioning at 23%, it woke me up and shook me to the point that I'm like, okay, God, what are we doing today? How we handling this? Okay, what else do I need to do? I had to shut everyone else out and listen to God, listen to my body. And that's how I got my turnaround. That's how I have a normal functioning heart. So I want people to know it can be very low, but you can also turn your situation around with good nutrition, good rest, prayer, nice relationships. What's the other pillar of health?
That holistic.
The holistic.
Avoiding risky substances. Yep. So stress, nutrition, exercise, healthy relationships, avoidance of risky substances, and good sleep.
Yes, and I literally had to let some people go because they were truly toxic to me and my health. And I told a couple people that I can't do this anymore because you're literally making me sick.
Mm-hmm.
And I'm not going out like that. My best friend, I say, we ain't going out like that. I'm not going out like that. I'm worried about you when you just keep doing what you're doing.
Doing what you're doing, right. And I got all the burden. So Dr. B, speaking of, we're talking about hypertension, and I don't know what it's called when your pressure is too low, but as Ruth said, she had extremely low blood pressure, which I believe is equally as dangerous.
Yes, well, it's not equally as dangerous, but it has its own dangers. It's called hypotension. So the reason you need tension, in your the tension in the blood is because you need a certain amount of pressure to push blood through, right?
Yes.
So you need just the right amount. You don't need too much or too little. If you have too much, it's putting undue pressure and wear and tear on your body, on your vessels. If you have low blood pressure, it's almost like water. You know how you live so high or in a place where they don't have enough water pressure and you just cannot get, water comes out and you're like, man, I can't even take a bath because the water is barely coming through, or I can't do anything. So it's the same thing with low blood pressure. You just don't get enough pressure to get this blood through the rest of your body. Mm-hmm. So you're not getting good blood supply, and we live off of blood. The life of everything is in the blood. Blood cleans out, it supplies, it nourishes. So when you don't have good blood supply, you have a problem. And then as people, again, part of it is as you get older, your blood vessels are not as compliant. So if you're not getting good blood supply, you're more likely to be dizzy, because how are we going to get this blood up to the brain? So when you stand up or you change position suddenly, you could get dizzy. And what's the next thing? You're going to fall, and then you break your head or you break your hip. So it's just one thing after the other when you don't take care of problems early.
Exactly. You take care of it early, make that a course correction so that you can live that life that truly represents a child of the King.
Yes.
Because broken down and ill is not a good representation of my Heavenly Father. Just
Plus, he can't even do his work because you're just trying to survive. Instead of striving and going out and making things happen and helping people, you're just barely trying to survive.
You're just barely making it yourself.
Exactly. And I could barely
exercise, and there's no such thing as we can't exercise, because there are now cheer exercises. There are things that you can do sitting down while you're watching television, while you're knitting. They have that new that little bicycle thing that constantly moves your feet. So when you can't walk, I've had 3 major accidents. So walking for me is a push. I really have to push in order to get that walking exercise in. But I've now started doing the cheer exercise. And as a dancer, as Ruth always said, that's the easiest exercise you can do, the dancing. Put on some music, some worship, begin to dance and exercise that whole entire body. You don't even realize that you have been exercising. But I think when we use the word exercise, we think about having to go to the gym. We think about set aside a certain amount of time to, get that exercise in. Our naturopath also says that you need to exercise the same time every day. That may be a little difficult. He said, but if you get up early in the morning and get that exercise in, then you got the rest of the day. You don't have to think about it. And now you're training your body to realize, I don't have to conserve energy because she did a little exercise. She's doing this every day. Okay, so now I can get my body back into function. So we're talking about the impact of high blood pressure on the African-American community and some of the health threats. Again, I said, about 55% of Black adults have high blood pressure, and it's a disproportionate amount concerning, the other races, the other ethnic groups. So historically and systematic factors play a part. And among some of those, again, are the conditions in which we were born and raised, the risk factors of not eating properly. We know that some of these things can be reversed. As Ruth said, her heart, which was functioning at 23%, is now working and functioning at 100% functionality. So what are some of the things that we can do to reverse, outside of the diet, outside of the exercise, which are very important, but are there other things that can be done? Well, I'm sorry, I guess I should say outside of medication. What are some of the things that we can do that would help us to get that blood pressure down where it needs to be?
Okay, so the first thing I always tell patients is, if you do not acknowledge a problem, you cannot fix it.
That's true.
If you don't even identify, you can't fix it. I want to read something interesting right here. Give me a second, please.
First things first, just, the scripture says that everything that is named is subject to the name of Jesus. So if you don't even give it a name, it can't be subject. If you can't make it subject to the name of Jesus, you can't make it be subject to your health. And a lot of people walk around, I don't want to name it. If I give it a name, it becomes real. But yes, it needs to become real so that you can now begin to do something about it. Dr. B?
I just want to read a little something here. I really liked what Tina Turner is gone, but I just want to read it because, she was an icon. Okay, she was a lot of things that a lot of people admire, but she made the same mistake that a lot of people make. This is Tina Turner. She explained that she had suffered hypertension, which is high blood pressure, for decades. She was first diagnosed in 1978, but she said she thought it could be normal and didn't think much about it. She said she also didn't recall getting an explanation for the role that hypertension plays in kidney disease. So the Proud Mary singer said she was given a prescription for medication to treat her hypertension in 1985. That's how many years down now? 8 years down. And it sounds like she took the pills, but she also said she didn't give her condition any more thought. She didn't care about it. Fast forward to 2009, when she said she suffered a stroke because of her poorly controlled hypertension. As she tried to get back on her feet, she learned that her kidneys had lost 35% of their function. Now she said, what did she do now? This is how many years later? This is almost 78, 88, 98, 2000. So this is 31 years later that she's trying to do something about it after a stroke. I tried to learn more about this organ's function and meaning. Most people probably don't even know where their kidneys are located and what they are for until their health is at stake. Then, of course, she ended up having intestinal cancer in 2016. And when she had that, what did she do? She stopped taking her blood pressure medications again. And that is just a big no-no, especially when you already have an organ failure. So even after suffering a stroke, Turner said she stopped taking her prescription medication for hypertension, convincing herself that the pills made her feel worse. I remembered relishing life before I started taking them and wished I could be as clear-headed and energetic as I used to be. So this is one thing too. And it's a place of empathy for patients that have high blood pressure. When you have high blood pressure that is not severe and you're not having the headaches and the blurry vision and all the other things, you don't really feel bad. So you don't see a reason why you should do anything. A lot of blood pressure medications have side effects. Some of them can make you a little more tired. Some of them can take away the wind from you. Some of them, like the beta blockers, we used to say beta blockers make you boring, right? So especially for the men, it could cause erectile dysfunction. That's a big problem for a lot of people.
Oh, yes.
So they'll say, wait a minute, I have high blood pressure, but I'm functioning well. And now you give me a medication, my blood pressure is low, but I can't get my life straight. I'm not doing it. So you have to learn to get patients to have a realistic expectation of how to manage their blood pressure. And that's why, again, a bigger part of it is trying to prevent it as best as you can and trying to control as many risk factors as you can so that even if you have to take medication, if you have to take it, you don't need as much. And then there are people that just need a few more medications. And you have to come to a happy place where you accept that this is the price I'm going to pay to have a good quality of life. There's no getting around it. So for people that have family histories and they just have terrible blood pressures that you can't control with anything, you have to be more aggressive. Wow. So I'm reading this because I want people to say that, people to realize that nobody is exempt from ignoring blood pressure problems. There are so many things that can and will go wrong if you don't take care of your blood pressure. And it doesn't matter how much you ignore it, the problem is there and it's not going anywhere, and it's not going away and it's only getting worse. So you need to do something. So when somebody comes in with high blood pressure, or when we have to diagnose you, usually we don't diagnose it the first time they walk in the clinic. One of the reasons is because you need multiple readings to confirm. You're giving somebody a label. When you say somebody has high blood pressure, it makes some people even get high blood pressure, you know?
Yes,
so
that's true.
you want to give them multiple opportunities to check their blood pressure before you determine if they have high blood pressure. But again, there's a caveat to that. So when they come in, you measure it the first time, it's a little elevated, they have no symptoms. You're like, okay, we're going to do this about 2 more times. And what I always try to tell patients is get you a blood pressure machine. Even if you don't have high blood pressure, if you think you're you're hanging around blood pressure issues, get one and just check it at home for fun. When you get up in the morning, check it. Sometime in the middle of the day, check it. And the way you check it is you sit down for like 5 minutes, don't talk to anybody, just check, blow it up, and you're done. That's a little price to pay to preserve your health. So get it at home, even if you don't have, if you want to just for curiosity's sake, you have a family history or you're obese or whatever, just keep one at home and just keep monitoring your blood pressure and just making sure it looks good. Because the blood pressure readings you get at home, if your machine is good, it's usually a good one because you don't have anxiety when you're not in the clinic with white coat hypertension.
White coat syndrome.
And so we want to see numbers. We call it ambulatory blood pressure monitoring. Some places have machines, but now with all the smartphones and all the smart equipment, you can literally check your blood pressure as often as you want. So if you can keep track of that, that gives us a better measure of what your blood pressure is. And then we want to see things, blood pressures, like when you're waking up in the morning or going to bed, your blood pressure is supposed to be lowest at night and it's higher in the morning. If we see very high blood pressure tonight, we know you're in trouble because it means your body is not even following the normal rules of blood pressure. And if it's higher than normal, because in the morning you have what we call cortisol, that's what causes your body to wake up from sleep. Or when you're going to sleep, your body changes a lot of hormones to prepare you for sleep. And then when you're waking up in the morning, your body knows you're supposed to wake up. So it starts producing cortisol and getting rid of the melatonin so that you're ready and energetic to wake up. Part of that also means your blood pressure rises. We want to see that, but we don't want to see a very high rise, higher than normal. So those are little things that we cannot collect unless you bring us that data from home.
That's good, because I usually keep my pressure, I keep it in my phone. When I take it, I put it, whether I go to the doctors or wherever, if I'm doing it at home, I put it right in my phone at that time. So when I do get to see my doctor and he was like, well, how's your pressure been? I can pull it up, look right on my calendar, say, well, this day, it was this done. But when I checked it a couple of hours later, it was this. So my pressure has been good for the last 4 or 5 years. No medication, thank the Lord. I had gotten off of blood pressure medicine at one time, and then I had some health challenges that caused me to be back on medication, but I'm back off now, and we've not had any medication for the last 3 years. And I'm pretty sure that once I start adding a much more regular exercise regimen, we definitely won't have to be worrying about it at all. So realistically, Dr. B, is it realistic that you can actually get off of the medication?
Absolutely, ma'am. Absolutely. Blood pressure has a couple of different factors. One is genetic. There are some people that just, without even trying, they get blood pressure. And then part of it is environmental. So it usually takes, I call it a perfect storm. Like with any disease, there's a perfect storm. Okay, for example, many people smoke, right? But not everybody who smokes gets lung cancer.
That's true. No.
Not everybody who smokes gets COPD. But lung cancer incidence is highest in people who smoke. So who gets to get it and who doesn't? See, that's the thing. We don't know who's going to get it and who will not. But if we look at certain risk factors, for example, if your family member had it, we know maybe you're at higher risk, a close family member, of course. And then same thing with blood pressure. So we're looking at your risk factors, and we're looking at you as a person. Things like maybe you're obese. Obesity usually increases your risk for blood pressure. If you're a heavy salt eater, that's not true for everybody, but especially African-American populations, they have a very strong correlation with salt intake. If you're not exercising, like you're sedentary, if you have a lot of stress raises your blood pressure. Think about it. When you get angry, what happens? You feel your body kind of tighten up. Mm-hmm. You're not getting enough sleep, because when you don't get enough sleep, sleep is a gift. It's a gift of rest and restoration for the human body. And when you don't get enough sleep, your body perceives it as stress, and it behaves like a stressed out body. So when you don't get enough sleep, your body perceives it as stress, and your blood pressure starts going up and all those things. So sleep is critical. When you're stressed out, like we said, in relationships, and then of course there are substances, things like alcohol can raise your blood pressure, cigarettes can raise your blood pressure. And so there are things that when people use them, we know that this person is at a higher risk. So the way to get off of blood pressure medications is, 1, to work with your doctor. Number 2, you have to make changes. You can't keep doing the same thing and expecting different results. Number 3, if you're wise, when you get off of medications, you need to keep monitoring. Just in case something changes, you don't want to miss it, because remember, it's a silent killer. It just sneaks up on you with a lot of problems. So you can do it, but it takes a lot of commitment. It takes hard work. It takes determination, and it takes monitoring. For example, even if you're in cancer remission, right? We don't stop checking to make sure that it has not come back. We know you're in remission, but we want to keep an eye on it. So it's the same thing. You are predisposed. Don't ignore it and say, well, I feel good right now, so I'm okay. Keep an eye on it. If you keep an eye on it, it also helps you to discipline yourself.
Mm-hmm. Something she said, we were talking about, I wanted to talk about the hereditary aspects of, and why is blood pressure hereditary? I know a lot of things are hereditary. They look for cancer to be hereditary, blood pressure. My mother, all of my entire life that I know, lived on Valiums, because her blood pressure was at stroke level. I mean, 200 over 190 my entire life. And my sister recently passed from a very bad, very, very, very bad, because her blood pressure was equally as high like my mother. But my sister, my other sister, and my brother and I, we don't have those issues, but it was just my mother and my sister. So how does hereditary play into the fact that if your mother or father had these diseases or high blood pressure, that it's most likely that your family is going to trickle down to?
Well, ma'am, we don't understand all, and that's why I say medicine is so intricate. There's a lot we know, but there's a whole lot we don't know. But we do know that when you see warning signs, you should look out. And maybe someday they'll find a gene. There's some things here and there. There's some genetic issues like polycystic kidney disease and all those things, Cushing's, that make us, they predispose you to that because of the things that they do to your body and your body's catecholamines and so on, right? Those things that help with stress and fight or flight responses. So there are those, and then maybe there are certain family cancers or certain family defects that can cause you to have those. We don't know everything, but we do know that if you see somebody from a family with a lot of them, you should just kind of keep an eye up. And if you are from that kind of a family, just tell yourself, I'm going to be checking my blood pressure. It's not going to kill me. In fact, it's going to help me.
Right.
Because when there's trouble, I can try to mitigate it. And if I fail, I can immediately get care so that I can stave off end organ damage.
I did discover that one of the factors in causing high blood pressure is caffeine. Now, I'm not a caffeine drinker. I don't like caffeine. Caffeine gives me the shakes. I can't drink tea with caffeine, coffee with everything. For me is decaf. And if I have a caffeine tea bag, like a Lipton tea bag, I can make 4 or 5 cups of tea out of that tea bag because I dip it just a couple times. My mother always hated that I put the tea bags in the freezer because I was saving it for the next time. No sense of wasting a good tea bag. But every time I went to the doctors, I always not only had the white coat syndrome, especially when I go to my clinic, but I'm just finishing a cup of cappuccino on my way to the doctor. My mouth is still warm from drinking my cappuccino, and my pressure was always high at the clinic. But I go home, I go to another doctor late in the afternoon or check it later on, there was no pressure. Then I came to find out that the caffeine and the cappuccino, even though it's low, still provides and raises and elevates that blood pressure.
You know why, right?
No.
Caffeine is a stimulant. That's why people take it. It's a stimulant. And that's why if you have any predisposition, it's going to raise the blood pressure. It's going to give you palpitations because it excites your body. It keeps you alert.
Okay.
Same, it's not the same as things like Adderall, but it's a stimulant. If you can remember that it's a stimulant, then it makes sense. It stimulates your body.
That's a good point. Watch out for the stimulants.
Yes, they can do that to you.
Raise your pressure.
Yes. And then the other thing I was going to tell you about genetics, I always tell this to my patients, especially my Black patients, because I think we need to hear this, okay? A lot of us say, oh, I'm no longer a slave, I'm free, but you live like a slave. Let me explain why. I grew up on the continent of Africa. And the way people eat here is not the way Black people naturally eat. They eat off the farm, they eat lots of veggies, lots of whole grain, plant-based stuff. Yeah, and you see, if you travel back there now, things are changing as people start eating more westernized. But if you go back to the people that just live the life we used to live, you hardly see obesity. People don't go to the gym, but you see them, they're ripped. They don't
have to go to the gym. They walk 5 miles in the morning.
Thank you, ma'am. So we eat well, we are active, we get enough sleep, we have good connections with you. Not everything is perfect, but you have a lot of good social interactions and so on. All those things that will help you stay healthy. And so I tell a lot of my Black patients here, both Black American and recently immigrated African American, Black Africans, that listen, when you eat like that, you're still eating like a slave. The reason why your mother, your grandmother, and your great-grandparents ate like that is because they didn't have options. They were slaves. They ate what they could put their hands on. Now you continue to eat like that and call it culture. That's not culture. That's slave food. That's how slaves eat. Why are you eating like a slave when you're no longer a slave?
Eat like a cow and stop eating like a slave.
Yes, ma'am.
Yes.
Since I first heard her say that, I tell everybody that eating like a slave thing, I say that to everyone.
Yep.
Why are you eating like a slave?
So leave those chitlins, those hog maws, those pigs.
That's dirty food.
All that stuff that was the garbage that we were given. And that our ancestors made do with what we had because that's all we had, which is why they used a lot of salt and seasoned with a lot of salt. But now we don't
pork, lard, and all those nasty things you put in food.
Yes, we don't have to. I was watching something this morning. There's this guy that goes on these cruises. He goes to different places around the world, and because he's always wanted to travel around the world. But he was in Spain, and he was at this bakery where they make this famous dessert that's been around since I think he said the 17th century. And the man that was making, he was rolling the dough. He used, they said, pork lard, and he took a great big chunk of lard and he was just rubbing it on the dough. And I was sitting here getting so sick at the thought of somebody still using lard in this day and age. and this is a pastry that is, very famous for this place, but we don't have to eat like that. I don't even know if they still serve lard in the stores around here, because I'm switching very, very much heavily, depending on plant-based, especially since Ruth is always talking about what dairy does, and I can't really give it up.
Yep.
But I have switched a lot. It's plant-based yogurt, plant-based butter, almond milk for my shakes if I'm having milk as opposed to water. So I'm making the changes. And it only requires us to make one change at a time. We can't undo 30, 40, 50, however old you are. We can't undo the damages that have been done overnight, as I said earlier. Just begin to make one simple change. Change the way you eat. Change what you eat. Stop eating that meat in the morning. We should not be having meat before 12 noon. If you get your circadian rhythm correct, just begin to make one change. We're not trying to tell you to do everything at one time, not exercise, not go to bed. Make one simple change. Right?
Give yourself a chance at victory. I always think about this story, what happened with 911, the rebels. Remember, they had those rescue dogs, and the dogs kept finding dead bodies, and they got depressed, and they would not search anymore. So what did they do? Some of the firefighters started hiding in the rubble so that the dogs would find them live. And then they decided to keep looking. So when you discourage yourself, you're going to give up. Don't discourage yourself. Go one little thing at a time. And like you rightfully said, these are years and years of abuse you've been enduring and subjecting your body to. It's going to take some time to clean it up. Be patient, be kind, be forgiving, be gentle, but keep at it. Don't stop. Keep going. One thing with the family stuff that I always also like to point out, remember I said part of it is genetic and part of it is environmental?
Mm-hmm.
The reason why things tend to run in families is because we have genetics, which is the predisposition, but we also have the behaviors which people tend to engage in as a family. So what do? Okay, we are predisposed to maybe metabolic syndrome or the wrong body type or high cholesterol and all those things, right? But guess what? Every week, what do? We all sit down together and eat some fried chicken. And every week we all sit down together and eat, Thanksgiving, we eat our hearts out and we sit down there and watch TV. So you would notice when one person steps out of that lifestyle and changes, all of a sudden, a lot of those health diseases go away. So part of it is what you're doing, and part of it is how your body is set up to handle those problems. And so I always tell people, I think about it like a loaded gun or gasoline, right? If you have a gun with a bullet in it, if you don't pull the trigger, nothing is going to happen.
Right.
So your genetics is like that loaded gun. Pulling the trigger are the things you do. And I also think about the gasoline thing. If you have a gasoline spill, there's a bad smell, but what do you worry about the most? A fire. If you have a spill and you don't bring a fire over there, or you don't bring a match over there, you're not going to have a fire. So if you have this genetic predisposition, but you don't do things that push you over the wall, you're going to save yourself a lot of trouble.
Mm-hmm. Yes. I was thinking back to my sister and the disposition to blood pressure. And I recall the last time that we were together before she passed, she was drinking a pot of tea every day, a pot of tea, and she had like 3 or 4 Pepsis every day. Already knowing that she had high blood pressure issues. She was on like 3 or 4 different medications to control her blood pressure. But on the other hand, that scale was not balanced. She was taking the medication, but it was doing no good because she was putting all this caffeine in her body, and she was basically sedentary. She didn't exercise, she didn't really walk, she didn't do anything. She sat around, watched TV, and she shopped. The most walking she did was when she went to the store to buy a handbag. Okay, no money, but she bought handbags all the time. We had so many handbags from her. But we must be balanced in our health. We can't all of a sudden to say, you know what, I'm getting off my blood pressure medicine, I'm going to bring my pressure down, and now I'm going to start doing all of this. I'm going to do exercise, I'm changing the way I eat. You're going to be unbalanced again, and you may be doing all the right things, but it's still not being effective. So we have to have a healthy balance, and you can't get a healthy balance by yourself because you don't know what a healthy balance is. So you do need your healthcare professionals, you do need your nutritionists, you do to begin to exercise. So it's an all in. If we want to be whole and restore to wholeness, we must be balanced in our care. We are almost at the top of the hour, and I'm going to give this last 5 minutes to Ruth. Talk about nutrition and returning your blood pressure, while we're eating like a cow. Some of the things that we can do.
I do have another saying, which is love yourself healthy.
Okay, there we go. Love
Because
yourself.
sometimes we say we love ourselves, but we're not loving ourselves healthy. When it comes to nutrition, as we've said, and you've heard it several times, make that one change. What's the one thing I'm willing to do this week to push the needle in the right direction? So we were talking about sodas and caffeine. Can I drink one less soda, one less coffee today? What am I going to do? Because my health is my greatest wealth. This body belongs to God. It's a temple, not a playground or an amusement park. And you only go to the amusement park once or twice a year. So yeah, go have some fun, come back and do what you need to do. Whole food, plant-based is what I teach, because that's what gave me the best results, and that's what gives just about every modality of doctor says, if you eat more fruits and veggies, you'll have a better outcome. You cannot out-exercise a poor diet. There's no way you can do it, and some people think you can. Your body needs certain fuel, just like your car needs certain fuel. You would not put water in your tank and expect your car to run.
That's true.
Why would you put something, which I call non-food, because I don't believe there's junk food. It's either food or it's not. There's no such thing. Why would you put non-food? Real food gets moldy, gets old. If what you're eating doesn't get mold on it, it's not real food.
Wow.
If it has a long shelf life and you eat it, you're now shortening your life. The longer the shelf life, the shorter your life. So you have to realize these things. Read the label. Read it. And you see red dye, green dye, purple dye, whatever kind of dyes are in there. God made color. You don't need fake color to. We have this thing about eating with your eyes. But when the color is some kind of blue, whatever, that's not a God color. So if you want to eat the rainbow, Skittles is not it, okay?
I like that.
Yep.
Skittles is not the rainbow we talking about.
Right.
We're eating grapes and watermelon and apples. And if you look, because some people say, how, like being vegan or vegetarian, what do you eat? I have such an abundant supply. Do you have any different apples there are? Do you have any different types of lettuces there are? You could eat a different lettuce every day of the month. There's so many. We look at what we've been taught, and we need to have a paradigm shift in our thinking, because the other part is some of the stuff we're eating, we think, well, that's what rich people eat. That's what they eat. They eat that ice cream, and they go to the store and they get that 14-ounce steak and they eat that. No. Is it expensive to eat healthy? No, it's an investment. That's an investment.
It's investment.
Is being sick. Doesn't that cost a lot of money, doctor, to be sick?
Yes. Oh, yes, ma'am. Yes, very expensive. Not only does it cost money, I call it you're bleeding from both ends.
Yeah,
You're losing money paying for healthcare, and then you're not making any money because you're down.
And you're losing quality of life. When I was diagnosed with congestive heart failure at the age of 41, and they said I was never on the list for a heart transplant, but that was one of my good, the good news is you're still young enough for a heart transplant. Good news, heart transplants never go in the same sentence, okay? Just want y'all to know that. Good news and heart transplant are not the same thing. But I had to wake myself up. Wake yourself up. And don't say I'm denying myself. Say I'm deciding for myself.
Amen.
Don't say, oh, I can't eat that. Say I choose not to eat that.
You sound like me and my patients. You sound just like me and my patients. Like, I love my body so much, I'm choosing to treat it well.
Yes. And it's all about a mind shift. That's what some of what our patients what we're doing wrong, we need to have a mind shift first.
We're here to help you with that. So
And the nutritionist and the doctor, they are going to make sure that their information is in the chat box so that you can have it when you watch this show later on. But we need a mind shift. We're no longer denying ourselves, we're choosing. We're no longer denying ourselves, we're investing. I like it. I'm excited because now I've got
too.
and sharing with my family. We're not denying ourselves. You know, I've been seeing some Instagram clips, and we are at the top of the hour, but I'm just going to share. And I've been seeing a lot of videos and clips on cauliflower steak, where they're just taking the whole cauliflower and slicing it and then roasting it and seasoning it and adding some different veggies on top of it. I'm like, I can do that. That's a good meal right there. A whole 1/4 inch slice of cauliflower as opposed to rice, which I basically have given up. So I do the rice cauliflower and the rice vegetables. But at the top of the hour, we're going to take a break. We're going to ask our guests, Dr. B and Sister Ruth, if they would just, take a minute. You may need to go get a drink of water and come back. But we're going to play our anthem at this time. I did have it ready. Yep, it is. When I get these things ready before the show, they all of a sudden don't want to work when it's time for them to work.
What did you eat for lunch? Maybe they're upset about your lunch.
We'll be right back after the.
Oh, Africa. Oh no, Africans, Africans for Africa, 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 Africans, Africans for Africa. Africans have many bright ideas. If only you let us share. If you really want to know my history, please come, sit down, listen to my story. God gave us a wisdom. He guides our footsteps, makes us shine and transform. Hey, as one people with so many cultures, yet indeed we are one. Stand up, Africans, let's save Africa. Let us all unite behind Africa Online Media Corporation. Stand up, Africans, let's save Africa. It's time to come together, promote awareness, progress, and solution. Hey. Africans, Africans for Africa, Africans, Africans for Africa, Africans, Africans for Africa. All Africans can rally for a common cause, to believe without judgment in what our brother does, to identify and resolve our challenges, to allow each other's ideas without regard to standards. As one people with so many cultures, yes indeed we are one. Stand up, Africans, for Africa. Let us solve all the problems plaguing our continent. Stand up, Africans, let's save Africa. Let us empower Africans in and out of Africa. Stand up, Africans, for Africa. Africa Online Media Corporation, that's a good way to start. Stand up, Africans, let's save Africa. They have all the resources we need to benefit our society. Oh. If we believe, there will be education for everyone. If we believe, prosperity for Africans. If we believe, medical facilitation for Africans. If we believe, stand up, Africa, yes, for Africa. Africa Online Media Corporation, that's a good way to start. Stand up, Africans, let's save Africa. Africa is the cradle of civilization, the motherland. Stand up, Africans, for Africa. We were enslaved not because we were weak, but because of our hospitality. Stand up, Africans, let's save Africa. Jump on the Africa Online Miracle Jet, don't be left behind. Stand up, Africans, for Africa. Together we shall succeed, together we will win. Stand up, Africans, let's save Africa. We are writing our own story, the truth, and we shall tell it to the world. Stand up, Africans, for Africa. No more lies, Africans own Africa.
No more lies. Africans own Africa. That is our theme, written by our very own Reverend Pam, the chairperson for Africa Online Media Corporation. Usually at this time, we will be talking about what the theme is.
Yeah, I will. I will make the announcement. Can you stop sharing your screen, please?
It's trying to stop, but it's still spinning. It's thinking. It's not shut.
Well, okay. Anyway, thank you so much. Dr. B, I apologize that I could not be too active on the thing, but you're in good company. You know, next, this is the last Sunday of May, and we are going to June. We are going to dedicate June to our men, our brothers, our fathers, our husbands, our sons. We need to empower our men. They don't get enough support, even from us. So we're dedicating the entire month of June to our men. And next week, we'll start with empowering the Black man. Ambassador Lisa, we need to get some mentors to be on here. But we want all the sisters to come on and show love to our brothers. How about that? Ambassador Lisa, can you hear me, Ambassador Lisa?
Ambassador Lisa is frozen.
I know. Okay. What about you, Sister Ruth? Can you hear me?
Yes, ma'am. I can hear you.
We can hear you.
Yes. Okay. I'm stopping her shared screen. I'm trying to stop. Wait. Okay. For me to stop her screen, I think. Okay. There she goes. Yes. And so, of course, we have we have our ongoing Operation Borehole 55 fundraiser, and we are not even doing the GoFundMe anymore. We are doing the okay, Ambassador Lisa, are you back?
Seems like it. Can you hear me?
Okay, yeah, okay, proceed.
Yes,
yeah,
I'm back.
Right. You can talk about the fundraisers, and then I will share the screen for the early event.
Okay, wonderful. Africa Online Media Corporation has an ongoing fundraiser. We call it Operation Borehole 55, and we want to put a borehole in every country on the continent of Africa, but we can't do it without your help. See, there are many countries, actually all of them, that have government-approved clinics that do not have running water. No running water does not equals no cleanliness, no proper hygiene. And we want to be able to do something about that. Our first project is up and running in Sierra Leone. The clinic is, not only does it have clean running water, it also has solar panels, and the delivery room and the waiting room have both been wired for electricity and lights. So this clinic now not only has clean running water, it has lights and it has solar panels to keep it running, because one thing Africa has a lot of is sun. Not only are they being blessed with clean running water, there are 6,000 homes, 6,000 households in that village, in that city, in that town, that also now have access to clean running water. And we are so excited. We're so proud of the work that we have done. But we want this to continue, and we can't do it without you. So we need your help by making donations. It does not matter how large or how small your donation is. All of it goes towards the borehole project. We don't care if you donate every day, $1 a day, if you donate every month, everything goes toward the project, and every dollar and every dime counts. So if you would visit us at our website, which is at www.africaonlinetv.org, that's www.africaonlinetv.org, you'll find a donate button there, and you can donate any amount of rand, any amount of dollars, any amount of pounds towards the borehole project, so that our sons and our daughters can now have access to clean running water. We, on average, I believe we use approximately almost a gallon of water just brushing our teeth when we leave that water running. You turn the water on, you brush the appropriate amount of time, leaving that water running. That is so much water that you have wasted, that someone in Africa does not have access to. We want to think about some of these things, and we want you to make donations. We're begging you, please, please, ma'am, please, sir, donate and be a part. My assistant pastor always says, if you sow there, you can go there. We need you to sow into our Operation Borehole and help the continent of Africa to get clean running water in our medical facilities. Again, that's www.africaonlinetv.org. Thank you so much. Reverend Pam, back to you.
Yes, let me share my screen. The good thing is both Ambassador Lisa and Dr. B. Tadzong were at the event in Atlanta. This is our 4th annual summit and charity ball. This year is going to be Labor Day weekend in Los Angeles. Can you guys see my screen? Okay, so if you go to our website, africasbrainbank.org or www.africasbrainbank.org, and you click, it says purchase ticket or more, it will take you to the ticket link. Ambassador Lisa, we have less than 100 days to go, 96 days. Can you believe that? It tells you about the brain bank, about the summit, gives you the itinerary. You know, we're not selling tickets at the gate, and tickets were supposed to go up on June the 1st. Some people in Africa pleaded that we should just extend it for just to give them a couple more weeks. So we're gonna extend it to July the 1st. July the 1st, okay. Tickets are gonna go up by 20%. So everybody needs to buy their ticket now. And the reason why we agreed to it was because some of the countries don't even have international banks. They're trying to figure out to send their money. That's why we did that. You know, so yes. So it's gonna be, Dr. B, this time we have a business to investor to business event on Friday. And then on Monday, we are going to have a wonderful, relaxing, and more networking time for sponsors, speakers, and delegates. You know, on Monday at a $14 million result. You know, somebody is giving us that to use. So purchase your tickets. Dr. B, take a minute and share your experience during last year's event and tell people why they should be in LA. And then Ambassador Lisa will do the same before we round up the show.
I had such a good time. One, it was very refreshing to meet people that love the continent of Africa, love the African people, and are willing to bat for it. They're willing to go out and on a limb. And it's also nice to realize that you're not the only one fighting for a better Africa. We Africans are not better than other people, because I strongly believe that we're all God's creation, but we have been undermined for so long. In fact, we are a good quality people, but we are suffering from a terrible complex. And being at that conference really helped. There was a lot of discussion about how we got to where we are, and to realize it's not the end. There's a lot that we can do, and we need to work to reclaim our own identity that God has given us and our own place in society. The African person is one of the most undermined person, and just being there and listening to people and their contributions and their perspectives and what they think on what we can do to help Africa get back on its feet was amazing.
Awesome. Thank you, Dr. B.
Yes.
Ambassador Lisa.
Yes, I agree with Dr. B, but I think for me, the most profound thing was to be able to meet people that I have spent time with on Zoom. Are you still there?
I'm here. Yes. Yes.
Okay, because my whole screen just went blank. But
No,
to
we
meet
can hear. Mhm.
to meet people that I did not have a chance to know in person, that I know only from being on Zoom, I think for me that was the most powerful thing. Even though Reverend Pam kind of ignored me, she acted like she had known me forever and didn't have time. Understood the fact that she was running the whole show.
I am Ambassador Lisa. To be honest with you, it did not feel like that was my first time meeting you. And you know, I was busy as a bee because I was coordinating.
I know.
Yeah.
But to me, it didn't look like that was the first time meeting you, because we have been on Zoom for how long?
Yes,
for years.
Yes, for over a year. And when I introduced myself, she was like, "Oh yeah, okay, hi, nice to meet you," and kept it moving. I was like, and then she came and told me later, you know what, I already, and I didn't realize that I was actually just meeting you. But you know, we spend time on Zoom because of the pandemic and the separations. You know, they finally get to meet people that have been our guests on the show. I can't think of the doctor's name, but the one we had him right before the event, and he was one of the health people, and he was talking about the shakes that he made, and I made him promise to bring me a shake, which he did. He brought it to me. I think it was Saturday afternoon. He brought me one of the shakes that he had made, and we're still in contact. So that, you know, just being around like-minded brothers and sisters who care
Yes.
about of Africa, who care about educating the next generation of people, especially encouraging the STEM projects that we have, so that our children are not left behind. The pandemic has really done damage to our African-American race. Our children were not given tablets when everybody else was. Other schools have already had tablets long before, you know, there was a pandemic. A pandemic happened, and then I was scrambling trying to figure out how we're going to educate our children, and that is not the subject. But Africa's Brain Bank is interested in educating our children, especially in the STEM area, and that's one of the reasons why you need to come. Not only come, but bring your money, because it is a fundraiser as well, so that we will have funds to be able to send our children to school, to get educated, to stay on the continent and be educated right where they are. Reverend Pam, back to you.
No, thank you so much, Dr. B. Now we're back to our subject. LA will be a game changer, but so I wanted to, those who are listening, do yourself a favor and be in LA Labor Day weekend. Go and purchase your tickets. You know, tickets for Saturday is $250. If you want to attend the Billionaire Breakfast Brunch is $500. Those who want to attend the business to be investor to be, because we are matching businesses and investors. These are serious people. Yes, they are millionaires and billionaires in Africa, and they are coming. And they are coming with money, and they want to invest in the US. So bring your businesses, but you got to register. You need to register your business. Go to our website and register. You know, so that you can gain new market shares, expand your markets, go international, go global. You know, diversify your products. You know, so we have several delegates as of now, or as of a couple of days, well, yesterday, Saturday, we have about 80 confirmed businesses and investors coming from Africa. That doesn't include the ones in the diaspora. So if you know somebody who's a business person, you know, advise them to invest, believe me, because Africa is the last frontier. There are a lot of people there, and there's a lot of money there. Don't mind what you see there. There are people living big in Africa.
Living well, yes.
So quick, Dr. B.
Yes, ma'am.
Every time I do medical missions, and our medical missions is comprehensive healthcare, it's not just blood pressure screening or diabetes. 100% of the time, whether it's done here in Houston or in Africa, specifically in Nigeria, top diagnosis is high blood pressure, followed behind by diabetes.
Diabetes.
There are so many people, and every single time, 100%. There are people going around, even a lot of them are skinny. They don't even know that they have dangerous levels of high blood pressure. And this is not a white coat syndrome. This is not fear that people go to doctors of. No, we're talking about even the nurses that are taking it. We have RNs taking those blood pressures because we want to make sure, and then medical doctors seeing the patients during our medical missions. We want to make sure that the people are doing it know what they're doing, and they take the blood pressure at least 3 times. You know, I can't tell you, we're not talking about diabetes today, but I can't tell you how many people are walking around with dangerous levels of high blood pressure and they don't know it. Dr. B, why is that so? And this includes professionals, educated people.
Reverend Pam, remember what we said about blood pressure? It's a silent killer because it doesn't, for most people, they actually can function pretty well until all hell breaks loose. So most people don't really feel much. People may have an occasional headache and they'll blame it on something else. They may have an occasional blurry vision and they'll blame it on something else. And until something really bad happens, people don't realize they have it. That's why I said, actually, a wise thing to do is just to check your blood pressure, especially get your routine healthcare screenings. That's what a healthcare screening is for. It's for us to find things before they become a nightmare. So get your screenings. And if you don't get you a decent blood pressure cuff, average of a blood pressure cuff is about $40. Most people spend more than that on a lot of other things. You know, I have patients who tell me I can't afford this. I'm like, but you're smoking or you're doing this, you're doing that. Go get your blood pressure. It's going to save your life. Get a blood pressure cuff. And then there's some places, some pharmacies still have the blood pressure machine that you can go use every so often. And and they will check your blood pressure for you. If you hear of a health screening, please go along and get a blood pressure checked. And if you're going to take your time to monitor your blood pressure, try to believe what you see. Don't live in denial. I was just reading again that story on Tina Turner. She's like, the only reason I'm talking about it is because I was so ignorant about blood pressure for so long. And it's basically why I paid for it in my life. Because even though she got a kidney transplant from her new husband, from her current husband, and she got a lot of other things.
We lost Dr. B.
Yeah, we're having, there's a network issue. It's unstable internet here and there. That's what kicked me out. And I was like, what the heck?
Are you guys in Africa?
Huh?
So Africa is not the only one with unstable internet.
No, it is not the only one. I'm not sure what the weather is doing outside, but I know when it's windy or the helicopters and the planes are flying over my house, it knocks my TV signal because it's interrupting that flow of the signal from the satellite. So Dr. B, hopefully she gets to come back on before we are done and have her last word.
Well, maybe Sister Ruka answered the question. Why is it that, you know, there's so many people going around with high blood pressure? There she goes. Okay, here she comes.
Because we don't believe.
We don't.
And we always ignore. So yeah.
Dr. B, welcome back.
Yes. Thank you. I'm so sorry. My line I just got kicked off the line, so I had to go back and log in. So the reason why a lot of people don't know is because they're generally feeling well. And people always assume that if I'm feeling fine, therefore everything is okay. But the question I always ask is, how many of you just keep driving your car and say, well, because the car is driving, I don't need to do maintenance? You know, we treat our cars, we treat our things better than we treat our bodies. And all of those things are replaceable. Your body, this is all you have. And short of a miracle, correct, when you damage it, you're going to have to live with it until the end. And the end is going to be more bitter than it needs to be because you've damaged it irreparably. So what Tina was even saying was that even with all the transplant and all the money and all the resources that I have, once you started going down that pathway, it was a slippery slope because when they put you on transplant, when you have a organ transplant, you always have to worry about a rejection. They have to suppress your immune system. They have to do so many things to you. You just never quite feel right again. So I always say, you know, taking care of your body now is the price you pay to have good quality until the end. It's actually a choice. It's a choice thing. choosing to pay attention, choosing to get regular screenings, choosing to accept when things are not the way they should be, and to accept what needs to be done to fix it. It's on you, it's not on your doctor. While your doctor may neglect one or two things which we do not support, or while they may not have all the time in the world to pursue you, you are the biggest investor in your own health. If you don't take care of yourself, don't expect other people to fight hard for you. You fight hard and people are going to jump in and help you. Ignorance is no longer an excuse, saying, I didn't know. Now you know. Do better.
Awesome.
Thank you so much, Dr. B. One other question before we go, we are almost out of time, but there was one question I want to ask you about the stages. What are the 4 or 5 stages of blood pressure?
So I don't have all of my information on me right now. There's a pre-hypertension, which is one, it could be either the top or the bottom numbers. It's from 120. So normal blood pressure is less than 120/80. When you have the top numbers between 120 and 139 or 80 to 85, it's considered pre-hypertension. Then when you have from 140 to, I think it's 150 or 80 to 89, it's considered stage 1. I hope I'm not mixing them up. Then there's 140, there's 160 and above, which is considered stage 2. But I think that has changed a little bit. You know, the bottom number to greater than 90, it's a different thing. And then the things that worry us the most when patients come in is, if you come in, even if you are at pre-hypertension or you're at stage 1, if you're having symptoms, like somebody's always having headaches, they have issues with their vision, or they're having an abnormal heartbeat, or they're having palpitations, we kind of jump into correct mode, because at this point, your body's already screaming, it's already raising alarms. So something needs to be done.
So I wanted to bring that out before we close the show out, because I'm sure a lot of people are not aware that their blood pressure or hypertension comes in stages. You think, oh, well, I was fine and now I have hypertension, but you need to know that there are different stages of hypertension so that you can be aware. Like I said, we must be our own advocates. We must do our own research concerning our own health, because nobody's going to care about you like you care about you. We are almost out of time. We're going to take our last round of the table, and we're going to start with Ruth Presley. We want to make sure that you not only give us your last thoughts, give us your contact information. Tell us where we can find you. If we want to eat like a cow, we need a holistic nutritionist.
If you want to find me, my website is eatlikeacow.com. My email is eatlikeacow@yahoo.com. So it's easy to remember. And my last word is, you're in charge of your health. You are your primary caregiver.
You are the primary caregiver.
If you don't take care of you, and for those of us that live in community or have a spouse, or sometimes people don't even tell you the stuff that's going on with them. And then the next thing you know, you're at the hospital or in the emergency room because you were not aware. Take care of your body, because your body is the only place you have to live. And you don't want to live in a broken down shack.
That's true.
Amen.
You don't.
I like that.
And you cannot live outside your body.
Yes.
Yeah, we have not gotten there yet, where we can transfer our
gotten there.
mind and everything into computers or cryogenic robotic bodies. Thank you so much, Ruth. Dr. B, we want to hear from you.
Yes, ma'am.
I thought she's supposed to go last.
If you're not speaking,
okay, that's fine. Dr. B, go ahead.
All right, so we talked about what high blood pressure is, what it really, why it's a big deal, and why we need to not ignore it, because it is a silent killer. I didn't say it's a silent joker, it's a silent killer. And the joke is going to be on you. It's not going to be on the blood pressure.
Dangerous.
Again, some things that you can, if you have a family history, or if you're overweight, or you smoke, or you're unhealthy, you eat a lot of salty things, you are you smoke or you drink alcohol and so on, you need to kind of pay attention. It's always a nice idea to get you a blood pressure curve and check your blood pressure every so often. It's good to go. It's a good idea to go for your screenings. I consider that to be like regular maintenance. There are some things you need to watch out for. If you keep having them, you should kind of pay attention and maybe talk with your doctor and say, I have these issues. Can you please check me out for blood pressure issues? Headaches, which may include a pounding feeling in the head. You could have nausea, vomiting, dizziness, redness in the face, or just getting really hot in the face. You could be fatigued. You could have lightheadedness or fainting, shortness of breath, nosebleeds, blurred or double vision, heart palpitations, and then spots in the eyes, like when they talk about floaters and so on. And then also, if you have other health issues like diabetes and so on, you should know diabetes. We call them friends that hang out together: diabetes, blood pressure, and cholesterol. So if you have any of those things, you should definitely be looking out for high blood pressure. And what I want to impress upon you today is that ignorance is not your friend. Ignorance is actually an enemy that you need to get rid of fast. If you don't know, there are people who know. Talk to them. You know what we say, follow man where you know road. Talk to people, reach out, ask friends, do you know somebody who can talk to me about my blood pressure? Do you know any place I can go to and find more information? It's in your best interest. Blood pressure issues will not go away because you ignore them. In fact, they will become your nightmare. So fix them fast, fix them soon, and save yourself the drama down the road. God bless you.
Thank you so much, Dr. B. Reverend Pam, did you want to have a last word, or you still want to?
No, Ambassador Lisa, you will be. I just want to thank Dr. B for your faithfulness, and I can't wait for you to do a show on dermatology because I have a lot of questions on that. But thank you so much. And I'm sorry I wasn't too active. I had to be muted. A safe and blessed Memorial Day to everyone. Please take care of your health. Eat like a cow. And also, Sister, what's the second one? You have another saying. What is that?
Something about not being a slave, I think. Oh, no. Love yourself.
Love yourself healthy.
Love yourself healthy.
Correct.
There you go. Thank you so much, Madam Ambassador.
Thank you. So we've been here talking about hypertension, some of the things that cause it, some of the things that will reverse it. We're so glad that you joined us today. Thank you again, Dr. B. Taza and Ruth Presley, the nutrition boss, Eat Like a Cow. We look forward to seeing you join us next week. I am your co-host, Ambassador Prophetess Lisa Parks. Thank you again. And this has been Africa Online TV. We'll see you next week.
Thank you.
Thank you. Bye-bye.
God bless you. Have a wonderful weekend.
God bless you.
Happy Memorial Day. Happy